Even though monkeypox has not yet been declared as a public health emergency, this country is taking all necessary precautions to prepare. Chief Medical Officer Dr. Roshan Parasram says especially now that a case has been detected in Venezuela, there is more reason to be concerned. He points out that a committee attached to the World Health Organization is due to meet soon to consider whether monkeypox should be declared as an international public health emergency. He says if that is done, it will affect how Trinidad and Tobago responds to it, but assures that steps are already being put in place.
We have kind of preempted that decision, and we consider it a concern, especially now that you saw there's a case in Venezuela that has been confirmed as well, which is pretty close to us geographically. So we have taken the steps, treating it as a public health emergency of international concern before it is actually deemed that by WHO, just preemptively, because it's always better to prepare.
Dr. Parasram adds that port health officials are already on high alert.
So we're looking at our port health response, so ensuring that our port health workers have the essential training that is required to detect any unusual diseases, and of course take the necessary steps by way of isolation and treatment thereafter, and to ensure that we have a very informed clinical cohort in the country, meaning that the physicians are well trained as to how to recognize the signs and symptoms, and of course the public can recognize the signs and symptoms.
Over 1,600 cases have been detected across 39 countries, with 72 deaths reported so far.